There are really very few things that come with a lifetime guarantee. Modern technology hasn't solved the inconvenience of inevitable breakdowns. Constant use causes wear and tear no matter how well built it is or how much maintenance you provide. Your body is the same way. Through everyday work and play, some body parts suffer repeated stresses that eventually take their toll. Fortunately, today's technology has also supplied modern medicine with some repair or replacement parts where damage has occurred. Who would have ever thought a few years ago that a heart too weak to produce a strong beat could be supplemented by implanting a tiny battery-operated unit under the skin? Pacemakers have added productive and enjoyable years to the lives of many people. Worn arteries can be patched with Teflon grafts. And where would we be without replacements for our natural teeth? You are planning to benefit from one of the miracles of modern medicine. There are many reasons a person suffers knee damage. Some of the most common include joint deterioration resulting from severe arthritis, overloading your bone structure with heavy work, major injuries from sports, accidents, or even from repeated small shocks, and by just being heavy and carrying too much body weight. To help you understand, let's start with some basic facts you should know about your knee joint. It is the largest weight-bearing joint of the body and one of the most complex. The knee is basically a hinge-type joint. The lower end of the femur or thigh bone has a rounded surface which moves in a shallow groove on the upper end of the tibia or shin bone. Stability is mainly provided by the ligaments which link the bones together. The cartilage gives a cushion or shock absorber within the joint capsule. The muscles of the leg help control and activate motion, so you are able to bend and straighten your leg. When damage to one or all of the knee joint parts occurs, efficient walking and sitting becomes impossible. To accomplish repair of the joint and restoration of function, a team of health professionals will help you. Every member has the skill and special interest to help get you back on your feet again. Of course, your ability to follow instructions and actively plan and participate in your rehabilitation will help bring about your successful recovery. You are the most important member of your own health team. But let's start at the beginning so you'll know what to expect. As with any major surgery, there are basic medical evaluations and laboratory studies that must be done. You will be given a medical examination and asked about your general health. Special care will be given to any signs of infection. If any infection is found, your surgery will be delayed until it clears up. An infection anywhere in your body could spread to your new knee and cause complications. X-rays of your chest and knee will be taken, and you will have routine blood tests, urinalysis, and electrocardiogram done. You will visit the physical therapy department where you will be coming after your surgery for use of the equipment and the help of a therapist. Your physical therapist, or PT as they are often called, has been trained to evaluate the amount of movement in your joints and test your muscle strength. The therapist can also help you learn the best walking patterns with the use of a walker or crutches. During this first visit, you will learn the exercises to be done just before and right after surgery.
These exercises are quite simple, yet extremely important for improving the blood flow and muscle tone in your legs. First of all, I want you to pump your ankles up and down.
Like that?
Exactly.
It's not too hard.
Okay. Second, tighten the muscle on top of your thigh by stiffening your knee as straight as you can go.
Like that?
Good. Real good. Okay. Third, I want you to squeeze your buttock muscles together as tight as you can.
Okay.
I always tell them, pretend like you got a dollar bill there and you don't want me to pull it out.
Lose it. Right.
You'll receive the greatest benefit from these exercises by doing them at least 10 times every hour that you're awake.
All right.
All right?
The day before surgery, preparations begin to help prevent the chance of infection. Your knee will be scrubbed with a special antibacterial soap. You will be visited by an orthopedic nurse who will explain what is going to happen when you get to the operating room.
I have your surgery permit here for you to sign after you read it over.
Okay.
If you have any questions, I'll be glad to answer them. In fact, several of my patients keep a pad and pencil handy to jot down the questions as they think of them. And then when the doctor comes by, they remember the questions they wanted to ask.
Later on, an anesthesiologist will be by to discuss the most suitable type of anesthesia for your surgery. He will be particularly interested to know if you are allergic to any medications, and will also answer your questions about the anesthetic for your surgery. As with other surgeries, you will have nothing to eat or drink after midnight. An empty stomach is necessary to help prevent the complications that can occur if fluid or food from the stomach is aspirated into the lungs during the operation. The doctor usually leaves a written order for medication that will help you have a good night's rest, so just tell your nurse if you wish to take a sleeping pill. Morning will come early because there are several things that need to be done before you go to the operating room. If your surgery is scheduled first, you will be awakened around 5:30 and your operative knee will be shaved. Several times you will be asked by different hospital personnel which knee you are having the operation on, and you will feel like you have repeated answering this question more times than is necessary. This routine is a safeguard for your protection and should be considered another evidence of concern for the best possible care for you. You will bathe and have repeated scrubs to the knee and be ready for your preoperative relaxing medication about a half hour before your surgery is scheduled. At this point, every possible source of contamination is guarded against. The nurse will wear sterile gloves to give your pre-op medication, and sterile sheets are put on the transportation cart. For this reason, your relatives are asked not to touch you or the linen on the cart. You will be taken to the operating room where your anesthesiologist will start an IV. This solution will help replace body fluids and also be an easy route for giving medication. EKG pads will be placed on your body so your heart can be monitored at all times. A blood pressure cuff will also be applied, and your anesthesiologist will give the type of anesthetic you discussed prior to surgery. Actually, the name total knee replacement is somewhat misleading because the knee joint is not completely replaced. It is resurfaced. This process could be compared to having a new finish put on a piece of furniture. It would add new durability and function to the worn part. In the normal knee, cartilage covers the weight-bearing surface of each bone to provide smooth, friction-free movement and is constantly lubricated, nourished, and bathed by the synovial fluid or joint fluid. With the inflamed or degenerative joint, the cartilage which protects the end of the bone is destroyed in the area of inflammation or wear. To replace the rounded end of the femur, the surgeon fits a metal cover over the end of the bone. The shallow upper edge of the tibia is replaced with a polyethylene or plastic unit. In some cases, a plastic button to replace the kneecap is also used. These parts are called a prosthesis. Most prostheses are cemented into surrounding bone with a special bone cement. There are several types of total knee prostheses. Your surgeon will select the best one for your particular needs. Then, with experienced precision, fit the new parts into place during an operation that generally takes about 2 hours. Although you leave your room early in the morning, you won't be back till around noon. Your family should know you will be spending time in the operating room for surgical preparations. Also, a few hours after the procedure, you will be staying in the recovery room until you are ready to be taken back to your room. After surgery, your knee will be wrapped with an elastic bandage and kept elevated on a pillow. Ice packs will be applied to decrease the swelling. When the dressing is changed, you will notice the surgical staples that have been used to close the incision on your knee. This method of closing the skin is faster and generally causes less scarring. Another aid to your recovery is the drain that is placed under the incision on the inner part of your knee. By draining the old blood from surgery, the inflammation is reduced and healing can proceed with less pain. You can expect the drain to be in place for a couple of days after surgery. Be sure to tell your nurse if you become uncomfortable. Post-operative pain is expected, and your doctor has left written orders for the medication that can help you. There is no reason for you to suffer needlessly, so keep your nurse informed. Knee surgery varies from person to person, and pain tolerance is highly individual. You are the one best able to report on how your knee is feeling, so speak up. Another important aspect of your successful recovery is exercise. The deep breathing and coughing exercises and the leg exercises for promoting good circulation should be done every hour while you are awake.
I want you also to take a deep breath in and blow it out through your mouth. When you're practicing your coughing exercises, I want you to try and concentrate on a good deep cough.
Okay.
So take a deep breath in, hold it. I'll cough 2 times. If you're doing this correctly, you should feel your stomach muscles tighten and your abdomen kind of bounce.
Yeah, I did.
A day or 2 after surgery, you will begin to return to activity by sitting up and dangling your legs on the side of the bed. Gradually, you will progress to sitting in a chair and walking to the bathroom with help. Remember, at first you must have your nurse assist you in walking because it's so easy to slip or become dizzy and faint. An accident at this time could slow down your progress, so please call your nurse before getting out of bed, even for just a short distance. After a few days, you will be able to start your therapy. You will go to the physical therapy department, where a therapist will teach you exercises for your knee, and you will begin to walk again with the aid of crutches or a walker. Once you start treatments, you will notice some discomfort and soreness in your knee. Muscles that have not been exercised for a long time are now being retrained to take over the functions of walking. Some soreness should be expected. Just remember, you set the pace for your exercise sessions and will not be forced to do any totally exhausting workouts. Your therapist is your helping hand and will be working with you twice a day until you're ready to go home. During this time, you will be regaining your confidence, strength, and function. Remember that during your hospital physical therapy, your progress is not measured on a rigid scale. Each patient is different, but all will learn the exercises necessary to continue the recovery program at home. Occasionally, it is recommended that appointments with a therapist be made on an outpatient basis once you are home. Your own physician can best advise you on this. Keep in mind that your total knee replacement is quite an investment of time, money, and your future. By planning for your therapy and following through on the exercises, you are helping to protect your investment. Maintaining proper weight is another extremely important factor in complete recovery. Your new knee surfaces can only carry a certain amount of weight, and gaining extra pounds puts extra stress and pressure on the knee joint. Think of maintaining proper weight as insurance on your investment. If you are used to eating 3 hearty meals a day and feeling absolutely stuffed, it's going to take some planning on your part and also some help from the main cook at your house. You probably realize that even though your body size is about the same as when you were 20 years younger, and you are doing just about as much hard work, your metabolism has changed, and the calories just aren't burned up as fast. Therefore, what you eat isn't as easily converted to energy, but is more likely stored as extra fat. No one wants to give up all their favorite foods, and that really isn't necessary. You will want to modify your eating habits for life, though. Cutting back on the amounts is a great way to start. And if that is combined with increased exercise, you can count on a gradual weight loss. You don't need to dread feeling gnawing hunger pains all day long. It's a matter of choosing the right foods. If you and your family need extra help with suggestions on changing your eating habits and learning which foods are the lowest in calories, ask your nurse to have one of the hospital's dietitians stop by. They are available at no extra charge. Take medication only as prescribed by your doctor, and be sure to keep your follow-up appointments. No one should expect an instant overnight cure after total knee surgery. But with the skill of your supporting health team, plus your own determination, you can look forward to the freedom you can enjoy by being back in the mainstream of life